How does socialized healthcare work in the UK? Have you ever wondered how healthcare can be free at the point of use? In the United Kingdom, this is made possible through socialized healthcare, primarily represented by the National Health Service. The National Health Service, often referred to as the NHS, was established to ensure that everyone has access to medical care based on need, not wealth. This reflects the core principles of socialism, which focus on equity and collective support. The funding for the NHS comes from taxation. This means that when you visit a doctor or go to the hospital, you do not pay directly for those services. Instead, your taxes help cover the costs. This is different from many countries where healthcare is linked to private insurance or requires out-of-pocket payments. The NHS aims to provide a wide range of services, including hospital care, visits to general practitioners, nursing, and specialist treatments, all available to residents without charge at the time of service. The creation of the NHS was championed by leaders like Aneurin Bevan, who believed that healthcare should be a right for all citizens. He viewed the NHS as a form of pure socialism, opposing the idea that only those with wealth should have access to healthcare. The NHS represents a significant shift in how healthcare is delivered, focusing on making medical services available to everyone, regardless of their financial situation. In practice, the NHS employs healthcare workers on salaries, rather than relying on private practices that seek profit. This approach helps prioritize public health goals over financial gain. The government plays a crucial role in planning, funding, and regulating the NHS, ensuring that resources are allocated based on the needs of the population. This collective model supports the idea of social solidarity, making sure that no one is left out of receiving care due to financial barriers. While the NHS embodies many principles of socialism, it is sometimes referred to as nationalized healthcare rather than fully socialized medicine. This is because it has not completely transformed every aspect of healthcare relationships or eliminated private practice entirely. However, it remains a strong example of how socialist ideas can be applied to meet essential social needs through collective provision. In summary, socialized healthcare in the UK operates by providing medical services that are free at the point of use, funded through taxation, and managed by the state. This system reflects the values of socialism by prioritizing health as a social right and redistributing resources to ensure that everyone has access to necessary medical care.